listening to Tehachapi with Key Budge, Tori Costello, Greg Garrett, and Ashley Whitmore.
It's Tehachapi time. Key Budge joining you today. I have a special guest from Kern County Public Health, Kim Hernandez, lead epidemiologist. Did I say that right?
Yes, sir.
All right. Well, welcome to Tehachapi.
Thank you. Thank you so much for having me.
You know, you and I, we got to chat for just a minute or two before we started recording, and I kind of briefed you on, we were, Greg Garrett, myself, Maya Costa, we were in a conference in Fresno County, maybe 4, 5, 6 weeks ago. And it was a communication-based conference, but there was a lot of public health officials from different counties. And they gave us one of those real-world assignments, okay? And pick a topic, and we want you to make a presentation on it. And everyone that was in our group was from Tulare County Public Health, Fresno County Public Health, and we were the only ones that were really kind of the communication people, but only the only ones from Kern County. They all wanted to talk about measles. And Greg and I looked at each other and said, really? And we started in the conversation realizing that measles has made a comeback.
Yes, it has.
So let me ask you about that. And so with just in this in particular with measles and the comeback that we're seeing, what's it like here in Kern County? I know there's different parts of the state of California where they're seeing a little bit higher occurrence. Mm-hmm. But how are we looking here in Kern County?
So here in Kern County, we haven't had a case of measles, transmitted in Kern County for many, many years. If you go way back when, we had a huge outbreak involving more than 1,000 people back in 1991. So that was a long time ago. We do occasionally have exposures that happen in Kern County. All of the recent ones have not been in Kern County residents, but rather people who have traveled through Kern County and stopped for a reason. They took a break, they spent the night, and then they traveled onward. And then after the fact, we find out there's been exposure and that many people in our community might have been exposed to measles. Luckily, all of those recent exposure events have not resulted in any cases, mostly because many people are vaccinated against measles, and that the measles vaccine is a very, very effective one and produces immunity in the vast majority of people who've been fully vaccinated. What we see right now in sort of the resurgence of measles throughout the United States, it tends to pop up in largely unvaccinated populations. And so groups of people who have chosen not to get vaccinated run the risk of, when you get introduced into a susceptible population, measles is highly, highly infectious. 90% of people who have a measles infection are going to pass it on to another person. And this is actually one of the most infectious airborne viral infections that we deal with today, in that if you have a room full of people who are susceptible to measles, almost every single person in that room is going to get it. And measles as an airborne virus is also one that it's very, very small, and it kind of hangs out in the air. And so an air space can be contaminated with measles virus and cause an infection in another person 2 hours after the infected person has left. And so it's not just you and me being in the same room talking, but if I leave here and I'm gone for an hour and somebody else comes in to do the next podcast with you, they can still get an infection. And so measles is so highly infectious, and this is why we worry about it, because it's easy to expose lots and lots of people with just one person. And what we're seeing sort of in the U.S. today is that, even though we've declared the U.S. sort of measles free, we've had measles elimination since 2000, where we haven't had ongoing transmission of measles in the U.S. since then, what we do is we have sort of imported cases. People travel to other countries where measles is still circulating very regularly. And then if they get sick and then they come home, then they can transmit it to others. And so we see the same thing kind of happen throughout the states where, like I said, they may not live here, but if they travel through here and they stop at a gas station, stop at a restaurant, stop to do some shopping, then they have potentially exposed other people. And that our job at the public health department is to try to identify all of those people. So it's kind of not unexpected that this is something in a communications training and a communications group, they'd really want to talk about it, because a lot of communication has to happen, right? In a very public event, I don't know the name of every single person we're going to try to call and say, hey, you might have been exposed to measles, watch out for symptoms. And so it ends up being typically a very large public announcement, through the news, through all of our media, forums of saying, hey, if you were at this location between this time and this time, you might have been exposed to measles. if you've had, 2 doses of your measles vaccine, MMR or MMRV, you're very likely immune and don't have anything to worry about. But if you are someone like an infant and too young to be vaccinated, or if for some reason you haven't completed your vaccine series, there is, a high likelihood that you could come down sick. And so measles typically presents, with a high fever, and then you break out in this rash. And so people generally know they have symptoms, but unfortunately you can be infectious with measles before those symptoms really start. So before that rash breaks out, 4 days before, you might be transmitting it to other people. So this is part of the reason why it is so infectious and so easy to pass around, because I might be starting to feel run down, but I don't really know I'm sick, and I don't really know yet that I shouldn't be around other people. And so this is probably why it got brought up, because there's just so much communication that needs to happen with the public to find every individual person, trying to reach those highest risk people, particularly, our very young children, people who are older with sort of lowered immune systems, that we want to be careful, because while, most people before 1963, almost everybody got measles. But what we found is, 1 in 1,000 to maybe 3 in 1,000 people will die of measles if they catch it. And, 1 in 5, about 20%, end up in the hospital. And so this is something that can be really debilitating. And so this is why, this is one of the vaccine preventable diseases we have now, because there was so much effort put into protecting us from measles. And so this is another reason why it's really important to stay up to date on your immunizations. If you have young children, make sure they've been immunized against measles in particular, because it is so infectious. It can result in lots of complications. And it's just, something that can be really devastating, and used to be very devastating, in the US and around the world.
Well, let's go back to the vaccine, because that seems to be one of those words that now, since COVID, it becomes a polarization around that word. But there is history with the measles vaccine. There is a track record. We do have science behind it to know the effectiveness of this vaccine. We basically had eradicated it here in the United States. And then, so what's the age group that would normally get the measles vaccine?
So typically you get the measles vaccine when you turn 1. That's the normal age when you bring children in for their 1-year appointment. That's usually when you start the measles vaccine series. And like I mentioned, there's 2 different vaccines out there. There's the MMR, which has measles, mumps, and rubella. And then there's also MMRV, which is measles, mumps, rubella, and varicella, which is chickenpox. So, one of those 2 vaccines you typically start when you are a year old. And then most kids will get a second dose by around 4 to 6. So before you go into kindergarten, the 1 dose of measles vaccine is very, very effective. 95% of people with that 1 dose will be immune, and they won't get sick. They won't come down with complications. When you get that second dose in before you go to kindergarten, it's 99% of people will be immune. And so this is a very, very effective vaccine. Measles-containing vaccine has been around for more than 60 years, so it has a very long track record. What we use now, with the combination vaccines, I think the MMR came out first in 1971. So again, they've been around for a long time. And really what we saw, the effectiveness of it was, before the vaccine was available, 500,000 people a year were getting measles. 500 people a year were dying from measles in the United States. And after the measles vaccine was made available, during this time of, measles elimination, we've had as low as 34 cases across the entire United States.
Wow.
And so it's done a very good job at protecting, particularly our small children, because they're the most vulnerable, the most likely to be hospitalized, to get encephalitis and have brain damage, and to potentially die from this infectious disease.
So with this resurgence that we're seeing now, are we seeing it among children? Is that with here in California, are we seeing it more in Northern California, and it's kind of worked its way to part of Central California, or am I mistaken with that?
It pops up in different places,
Okay.
where we usually see sort of that first case of measles as it enters into a community is in sort of these larger metropolitan areas, right?
Okay.
If you think about, large events where people come from other areas to visit, and so that's generally where we see it. Every now and then it's a family member who came to visit, but it usually is people coming into large group settings. settings, because that's where you have the opportunity to expose lots of people. And so we tend to see it, kind of in the Bay Area or Los Angeles, San Diego kind of counties. And so we're generally in Kern County, not the place where we first see it happen. We can see sort of the after effects if an outbreak is going on. Currently there's an outbreak going on in Illinois, the state of Illinois, and they're really just kind of working on it and trying to wrap the services around the notification on people that says you might have been exposed, you need to watch out for symptoms, you should stay home if you develop any of these, you really want to avoid being in large groups of people just in case you get sick, because we just never know. No one wants to be the person that exposes that itty bitty baby who's too young to be vaccinated and who's especially vulnerable, because when little itty bitty babies get sick, they need a lot of help, a lot of support, and they often end up in the hospital.
Are we seeing less children get that vaccination now?
Yeah, unfortunately, when we look at our school-based data, when we look at kindergartners and their vaccination rates, we're hovering around 92% of our kindergartners have gotten both doses of their MMR. And if you think back just a few years, in 2016, we were at 97%. So the vast majority of our kids were being immunized and protected by the time they went to school. And so we do know after, the effects of what have gone on for the last few years that vaccination rates have dipped. And we're really kind of concerned about that because for measles in particular, we consider sort of a 95% vaccination rate enough to kind of protect the rest of the community. When you hear people talk about herd immunity, there's been a lot of talk about that. Because measles is so infectious, we need as many people as possible immune to it so it doesn't continue to transmit in a community. And so for many, many years in Kern County, we had really good vaccination rates. We tended to be at or above the state average. And in the last few years, we've kind of dipped down to, 91, 92%, which makes us nervous because if we think about the last time, in California, where we had a lot of concern about an ongoing outbreak was about 2014-15. If you remember, there was one that really centered around transmission happening from Disneyland, where a person brought it into, a large theme park like that, transmitted to a number of people. And we watched very carefully during that time with our proximity to LA of, are we going to have any residual cases from that? And we didn't, but we also had a largely vaccinated population. And so as time has gone on, and we have had less vaccination in some of our children, or at least delayed, right? Not on schedule as we would have routinely expected, that some of these kids are behind. Many of them have one dose, but they need to get their second one, into kindergarten because for a lot of these kids, this is the first time they're going to be around a lot of people. And of course, expose, and have that potential exposure in these group settings. And so this is something we're really working with a lot of our schools, with our healthcare community about making sure our kids get and stay up to date on their immunizations.
I guess it's one of the ripple effects from COVID-19.
Yes.
So kind of, as I just kind of mentioned, don't want to get on the political end of these, but it's the polarization of something. And here is something that was proven. It was proven to work, and then it kind of got thrown into a category of, no, I'm done. Where it's just another vax, it's another government ploy, but the facts were there, the science behind it. It worked. And I guess that's kind of the bottom line. Like you said, there's a big difference between 97% and 91, 92%. I mean, it doesn't seem like much, but it really is a significant number that if that amount of your population is exposed, or is susceptible, and Kern County, as we had talked, and maybe it was before we started recording, but we talked about this being one of those Kern County is an area where people come through on their next destination, whether it's going from San Francisco to Vegas, LA to Sacramento, whatever. They're going to stop here. They're going to get their gas. They're going to refuel. And we are the ones that end up with the kind of the impact, if you will.
Right. And then that's a really good point where we just, we know over the last couple of years, it was difficult for a lot of parents to get their kids into the doctor's office and to have their regular well child visits and making sure those vaccines were given, as well as all of the other things you check at those well child visits. And so, a lot of, transition happened with healthcare providers, where pediatricians may have closed practices, retired, things like that. And so establishing care again is really important. When we think about, sort of our older adults, they were likely vaccinated as children. And they were likely vaccinated as children because their parents saw the effects of people who didn't have a measles vaccine. Many people who are now sort of grandparents, they either had measles themselves, they knew somebody with measles, they knew somebody who got really sick, somebody who might have had seizures as a result, deafness as a result. And so they the risks and the benefits for them were very different than we see now, where you and I may not know anybody who's ever had measles, or know anybody, even if we knew someone, they may not have had those severe complications. But back when everybody got it, everybody knew somebody who was adversely affected. And so we kind of get through this sort of generational thing that says, well, it's not really a big deal, right? It's eliminated in the United States. We don't worry about measles anymore, but we forget if we stop protecting, we can easily slip back into a place where we get back to 500,000 cases and 500 deaths a year. And so this is something that's really important to provide that protection early on, especially when they're young, because especially with the measles vaccine, it lasts a lifetime. And, that we can protect the next generation by getting them vaccinated. Because, like any population, there's going to be that handful of people for one reason or another who can't be immunized. And so it really falls on the rest of us to be immune so that we don't get sick and pass it to those people who can't, use this tool to protect themselves. And it's our responsibility as a community to protect our most vulnerables. None of the, the babies being born today are protected against it. And they're not going to be protected for, at least 6 months, because you can get it a little bit earlier. But for most of them, they won't be protected for that whole first year. And so if you and I are immune and we can't get sick, then I can hug and kiss that baby and not worry about passing them something.
Yeah. I mean, as you're saying all this, I'm thinking about my grandson. Yeah. So I'm able to kind of visualize and understand, the impact, the importance. So I think today our hope and goal was to continue to provide that education and talk to the community. Our most susceptible are, like you said, the infants, but the elderly and pregnant women.
Pregnant women, if they aren't immune, right? Anytime you have a lowered immune system, most of our elderly, if you were born before 1967, you're really 1967, you're really kind of considered immune because very likely you had measles as a kid. Almost nobody got out of it unscathed. And so they're likely to be immune. But of course, as you get older, your immune system kind of weakens a little bit and you might be more susceptible to what we call sort of a breakthrough infection. Same thing if even if you've been vaccinated and you've had to undergo chemotherapy. Pregnant women, again, have a lowered immune system. And if they're not already protected, it's very possible that they could get an infection, which could, affect their pregnancy and affect that baby. And so mostly we worry about, those brand new babies in that first year of life before they've had an opportunity to be vaccinated. Because particularly if you travel or if you're exposed to people who travel, they're really vulnerable and they're the most likely to go to the hospital and to need that supportive care because there's no technical official treatment for measles. It's all supportive care of trying to make sure you stay hydrated, we take care of your fever. And so it isn't something where it says, oh, I'm going to get sick, I'll just go get treatment. You can't treat with antibiotics or anything like that. And so the best prevention we have is to develop some immunity in that sort of controlled situation that a vaccination allows that says, we're going to train your immune system to fight it. So if you ever get exposed, it's going to know what it is, fight it off right away before it can get established and make you sick.
Wow. Okay. So if there's someone that's listening that goes, you know what, I need to get my child vaccinated. We want them to reach out to their local doctor. Or maybe what if someone does not maybe have that doctor, or what are their options? Where can they go, or where can we send them?
Yeah, we always want people to stay in contact with their regular healthcare provider. Talk to your child's doctor. If you don't have a doctor for your child, to spend the time to establish one, because that's really important for kids in their entire development from a baby until they're grown up in that adulthood. There's milestones we want them to hit to be checked up on. If you don't have an established healthcare provider, at the public health department, you can always be vaccinated. We have our mobile health clinic, that has been going throughout the community that we can provide vaccinations on. Most of the times, for children especially, vaccines are free or very low cost. And so it's something we don't want it to be cost prohibitive, but they can look at that. Depending on the age of a child, you can also try local pharmacies. Most pharmacies, do carry the MMR vaccine because they do end up vaccinating a lot of adults, but they can, depending on the pharmacy, also vaccinate some children. They don't generally vaccinate babies, but if you have an older child who's kind of school age, some pharmacies can also provide the vaccine there. So we'd really encourage people to look. If they're having trouble finding it, to call us at the health department. We'll help them find sort of the most convenient location to them, or direct them to the next time our mobile health clinic is going to be in the area, or if they have the ability to come into our brick and mortar health clinic in Bakersfield, we'd welcome them there.
Now, so to kind of shift a little bit, before I do that and shift, is there anything else regarding measles that you think would be important to share? I mean, we've covered a lot. There's a lot of educational conversation that's taken place. It's really kind of hit home for me. Is there anything else that, because I want to kind of shift and talk about a couple of other topics?
Sure. Last thing about measles is, if you think you've been exposed or you think you might have measles, it's really important to call your healthcare provider instead of showing up, because what we don't want them to do, which has happened in some of these exposures where someone's feeling sick, they show up at an urgent care and emergency department or their regular healthcare provider and, inadvertently exposes everybody in the waiting room, exposes everybody in the doctor's office. A lot of times, and we learned this in responding with COVID, where if you talk to your healthcare provider, they might come and meet you outside in your car, right, or say, come in as the last patient of the day so that we don't expose other people. And so if you think you might have measles, you develop a fever, you have this really splotchy rash that, appears suddenly, or you've heard you've been exposed, or you've been somewhere where a measles exposure has happened, we want you to call first. You can call us at the health department or call your regular doctor, let them know, I think I might have been exposed to measles, or I think I might have measles. What do you want me to do? Because then they can give you directions and avoid exposing more people.
Be responsible. You're thinking about for others, which, very thoughtful. And that's, I probably, had you not said it, I may not have even thought to do that. So, thank you for sharing that. Now, I want to ask you about, I'm a flu shot getter. Okay. So, and have we kind of rolled through flu season?
Yep, we're on the tail end of flu season.
Okay.
Yep.
Because every fall I try to make sure I get my flu shot, and it makes a huge difference for me personally. I remember that it seemed like every year I would get something, I'd get the flu, and I'd be down for 2 weeks. Mm-hmm. I was one of those that just knocked me right down 2 weeks. Now I rarely get sick at all, and if I do, it seems like it's only a couple of days. It really minimizes, and so I'm a regular for the flu vaccine every year, but that strain seems to change. And that's so. What's the impact or the importance of getting that flu vaccination come fall?
Yeah, absolutely. Flu is unfortunately a virus that changes often. And so this is why, we have an annual flu shot, and sort of at the beginning of every flu season, we encourage you to get that annual flu shot because there's sort of these little changes that happen. And I kind of akin it to something like, if you change your hairstyle, right? It's still flu, but it might look different. And when you run into somebody who, had a drastic change in their hair, you may not notice them, the moment you see them, or you might not notice them from afar. And so you might have to get up close or hear their voice or notice other things that says, oh, this is something I know and recognize, or someone I know and recognize. And so the same thing happens with flu, where it changes just a little bit every year, that our bodies might take a little longer than we want to notice it and fight it. And so this is where we see sometimes we have these, we call them antigenic drift of where it's sort of changing year to year because flu is traveling around the world constantly. Our flu season tends to be in our winter months. In the southern hemisphere, it tends to be in their winter months, which is our summer months. So while we're sort of enjoying the heat of the summer, flu is circulating other parts of the world. And then when it comes back around to us, it's gone through, millions of people and has had a little bit of a change. There are times where we have what we call antigenic shift, where we have a major shift in that virus. And if you think way back when to H1N1 swine flu, back in 2009, that was an example of we saw a huge shift in the influenza virus. And so our bodies didn't recognize it. We didn't know it was flu. We didn't know it was bad, and we couldn't fight it off as quickly. And so that's why we saw a lot of people get sick during that time. And so then there was a change in the flu vaccine that says, oh, we need to make a shift. This is what's commonly circulating. Let's tell everybody about it. Let's tell all of our bodies about it. That says, look out for this one. It's putting it on that big wanted poster saying, be on the lookout. Here's what's likely coming around. And so that way, when we are exposed to something like flu, our bodies will recognize it. And so this is why it's important to keep up with it every year, because some people are like, well, I got one last year. Do I really need one this year? But every year, about this time of year, we're actually looking at what's circulating in the southern hemisphere, getting ready for what we might see in the fall so we can start that production and prepare for it. It's not always perfect because what is circulating the southern hemisphere right now may not be what's circulating at the end, right? There's sort of this ebb and flow of what's spreading at any given point in time. And so that's why some years the flu shot's very good and it has a really strong protective mechanism. Other years it's not as good and, you still might come down sick. Hopefully, as long as you're getting that flu shot, even if you did get sick, it's going to be a shorter duration, right? Instead of being, super sick in bed for 2 weeks at a time, it might be a day or two. And for a lot of people, they kind of shake it off as it's just a cold when it might have been an actual, it might be influenza, but then they can be back up and running and doing their normal things quicker because we're just saying, here's a bad guy. Sometimes as our body learns all these things are things we want to fight, it starts making those connections, right? That's something that looks similar. It's going to say, you know what? That's probably something bad that I also want to send my immune system to fight off. And so that's why every year we say, okay, this is what we think is coming, but just in case, it's usually very closely related and recognizable to what actually ends up circulating in California, in the United States during our flu season.
Okay. Wow. It's amazing. I never even really put that global concept together and thinking about the different hemispheres and how it's summer here, it's winter on the other end of the world, the lower half, and vice versa, and things, it circulates. Yeah, I never even thought of it. You helped put it all together for me. I want to ask you about the hepatitis, or is there anything else going on in Kern County that maybe we should be aware of or be paying attention to?
So, in Kern County, as we're getting into the hot season, we always want to talk about things like heat-related illness, right, of being prepared for that, especially when we've seen a lot of this sort of hot, cold weather, of people just being aware that your body takes time to adjust and to be wary of things like that. As we get into the hot season, we also start talking about valley fever, for example. Right. We don't see a lot of that in Tehachapi, but if you're traveling around in the Central Valley, we want to make sure people are aware because oftentimes with valley fever, unfortunately, if people don't have super high of a fever, they may not seek medical attention. But valley fever is something that is treatable. And so, if you've had a fever, if you had a cough that just won't seem to go away, we really encourage people to reach out to their healthcare provider to ask to see if they need to be checked for anything else, if they need medication for it. Most people who get valley fever, don't need medication, but some can get very sick. And so this is another time of year where we want to warn people and just remember that, to avoid being out when it's dusty. And if you get sick, talk to your healthcare provider.
So with some of the wind that kicks up, I know a couple of people that have had valley fever, and they worked on the Antelope Valley side of Tehachapi, and they were in the solar, out in the solar fields, and the wind kicks up, and all of a sudden you're in the middle of a dust storm. Mm-hmm. So this is a spore that gets airborne through the dust, and then it beds itself in your lungs. Is that?
Yep, exactly. It's a fungus that grows in the ground. And so it typically grows, 6 to 12 inches. So it's not on the topsoil where the sun's exposed, right? This is a mold. Okay. And so it's growing where it's sort of dark. And so what we generally see is valley fever spores get kicked up when there's earth movement, a really strong dust storm that's kicking up tons of dirt, when there is new digging for any reason, if we're grading dirt or if we are digging trenches, those are opportunities where we expose the soil where that fungus lives. And then it gets kicked up in the air. We breathe it in as people. It kind of lodges in our lungs, and it's a fungus, and it starts growing, and it can make us sick. A lot of people, their immune system's going to respond. We call it sort of encapsulation. It sort of takes it and kind of controls it. Says, you are bad. We're going to surround you and not let you, make people sick. For some, very small proportion of people, it can get outside their lungs to other parts of their body, their skin, into their central nervous system and their brain, their joints. And so when it disseminates through your body, it goes to other parts outside your lungs, it can be harder to treat. And so all of it is, most people start with that cough, and it's usually a cough that doesn't go away. Unfortunately, what we find is we as people might be like, it doesn't bother me too much. And so we don't go to healthcare right away because we're like, okay, it'll go away. And we wait it out. And then we realize we've been coughing for a while. And then, during that time, it may have spread. And so that's why we really encourage people. If you've coughed for more than 2 weeks without, a reasonable explanation, you might want to talk to your healthcare provider because they might want to test you, because valley fever is a simple blood test. And so that's something we also want people to know is, it can be detected through a blood test while it's still in your lungs. If it goes to other places, sometimes it takes a little bit more work to diagnose, but we know it's throughout the Central Valley. Kern County is a hotbed for it. We know it grows in our soil. It's just really conducive to that. And what we actually think about is something like last year we had lots of rain and lots of moisture. That's sort of the opportunity where a fungus can grow. And then as it dries out, sort of as we get to the summer months and it gets a little bit more arid, we get sometimes those, summer winds that come through as it starts blowing up in the air. And so we want people to sort of be aware that it's out there. Lots of people in Kern County have already been exposed sometime in their life. They're likely, immune and not going to get sick from it. Most people don't. But if you are new to the area, we want you to be, to be knowledgeable that if you get sick, to talk to your healthcare provider so that they can, do a full assessment. Might be something completely else, but if it's valley fever and they want you on treatment, we want that sooner rather than later.
Right. I'm a regular blood donor, and I know one of the questionnaires is, have you ever had valley fever? So has that become like a disqualifier as a blood donor? Do you know? I mean, is that if you've had it, or is it something that once you've had it, and is it always with you and you're always kind of a long-term disqualifier to be maybe a blood donor? Or
yeah, I asked them this question a long time ago, so I don't want to misspeak, but I believe when I kind of asked, why do you guys ask about this? I believe they told me that they just want to check to see how long it's been since you've had it, or you've been diagnosed, or are you on current medications for it? Because some people with valley fever will need to be on a lifelong medication. Okay. Most people do not. Most people, it's, 6 months or so of treatment, or, and just depending on how your body is responding. But it's just one thing, because it's so common here, they want to make sure to check that you're not actively sick, obviously, right? We want healthy blood donors, and that we want to just, they're checking to make sure there isn't any reason for you not to donate blood. So as far as I know, it doesn't automatically disqualify you from ever donating again, because there are some conditions, will they ask you not to donate afterwards. But as far as I know, for valley fever, they just want to find out if you've ever had it, and then they ask you, well, how long ago have you had it? Are you still seeing a doctor about it? We talk about titers with valley fever, like what's your titer, to know, how is your immune system responding? Is it, fighting really hard against it, and maybe now's not a good time to donate blood, right? Put and tax your body some more. Or, was it 10 years ago you got diagnosed, everything's fine, hasn't been an issue. I believe you're still able to donate blood.
Interesting. Oh my gosh, I'm learning so much. I love these shows that when we have a guest like yourself on, and I'm able to learn in the science of different things, and everything that it seems like these topics are all science-based, and I'm just completely fascinated.
Well, we love to be here, love to educate. We love the questions, because there is so much, we love to share with people, because as we all know more, we can make informed decisions of what we need as a healthcare community, as a person, as our overall community here in Kern County.
Well, Kim, at Kern County Public Health, what are some of the frequent questions that you do get from the community?
Oh, goodness.
Put you on the spot there.
Lots and lots of questions, because we have just such a wide range of services. And so, today we're talking about measles, valley fever, infectious diseases, communicable diseases, which we get a lot of questions about because they get reported to the health department. But we run the gamut. We have a number of programs that work with maternal and child health and finding out, what to do during pregnancy, and educating people, and having nurses come, to your home and help you through that pregnancy and come alongside you to make sure you have, hopefully an easy pregnancy, an easy birth, and a healthy child. We have a number of programs around education and health education, tobacco awareness. And there's just, we get such a variety of questions. It's really kind of fun, because every day might be something new about what's going on in the world, and how can we help with those things. And so I think that's one of the wonderful perks of working in public health or around public health is it's everywhere, with, environmental health is also a part of our public health agency. So questions about, restaurant inspections, we tend to get things like that, or permitting for different types of, our wells, our septic tanks, all of that, come through our health department. And so we find it really valuable to be able to just educate people, because a lot of people don't know. A lot of the things that happen in public health are behind the scenes. And if they're working well, you don't even notice that everything is fine. And it's when there's a disruption and something says, there's a burst water pipe and we have to have a boil water notice, that, public health comes into light of all the things that hopefully run successfully in the background. And when there's a hiccup, a lot of this is education with our community, letting them know something out of the norm is happening and here's how you can protect yourself. And so I think, some of those interesting calls are probably, maybe the way to phrase it, are the most successful calls where people just say, I need help. And we really work and say, well, what do you need help? How can we help you and get you connected? Public health doesn't do it all. There's so many community partners, but we hope to be able to navigate people that says, well, what help do you need? Let's try to get you to that resource, to that person, to that agency. And I think, particularly our staff in our call center who answer sort of those generic calls, they do a really amazing job of just trying to figure out what people need, and that's what I hope. For us at Public Health, we always hope that, we're one of those first people that, first agency that people think of when they need help with something, because it may not be within our purview to solve that problem, but we can certainly try to direct you to the right place.
Yeah, it's fascinating when you started talking about the different permitting process and things. I am now, the Tehachapi Farmers Market is now in my department, and we're required to fill up permits through your department to make sure that our farmers market that we're offering to the community is to the correct standards, to make sure that it is, that all the vendors are properly licensed and everyone. There's a lot of work that goes in, but it's about the overall health of the community.
Yes, it's always about the health and the safety of the community. I know sometimes it feels restrictive, and it's like, well, why do we have to jump through all these hoops? And at the end of the day, it's because we want to make sure whatever we're offering to the public, to our communities, are as safe as possible. That we have gone through the steps that make sure, that a food vendor, for example, has undergone, safety training, so they know about safe food handling practices, and they don't end up giving us something that's undercooked or contaminated that then results in us getting sick and maybe needing to go to the hospital, and so a lot of that is making sure, that we have parameters that kind of safeguard all the things that are happening, because we want them to be able to happen. We want our community to get together and enjoy something like a farmer's market, because that's a wonderful opportunity to bring the community, to support our local community. But we also don't want it to be something that says, oh, you know what, when I went to that farmer's market, I did this or I ate this and I got sick and now I'm never going back.
Right.
So a lot of those things, ultimately are intended to protect that event, that organization, because one bad experience will keep a person from returning. And it will also keep more people from returning. That one person talks about their bad experience. It says, you know what, I got food poisoning from that. And now, dozens of people who might have frequented that business isn't going to show up, or whatever that kind of process is. And so, that's why at Public Health, we take a very sort of educational approach. It's not just follow the rules because I said so. It's understand why rules exist, because they're there to protect you and me, to protect our families as well, so that we don't have to worry about, a pool that hasn't been properly chlorinated and we might get a waterborne illness, right? And so those are things that says, that it needs to be chlorinated to a certain level. We have to check it this often so that, whoever is going swimming in that public pool knows that it's safe to do so. And that's, what a lot of the permitting processes are about, of making sure that we can, say to the public, our community's safe.
Yeah.
And that we've done all the things that we can, so that, one, you can make an informed decision about what you're doing, but also that some of these rules, safeguard us, because I can't know everything about everything. I have to trust that wherever I go, that the service I'm getting has been looked into, vetted in some way, and that it's a good thing or a safe thing for me and my family to do.
Now, you mentioned vendors, and as I brought up the farmers market and all the permitting, we make sure that everyone's got all their different permits in order as we submit for our environmental health permit. But we've worked very closely with Kern County Public Health and Bren, the director, in the Tehachapi area, because we've had a lot of illegal vendors or people that just set up roadside. Mm-hmm. And I want to, because based on I'm retired law enforcement out of LA, so I have some knowledge in this area, but I want you're an expert in public health. There's a reason why brick and mortar businesses. They've got permits. There's inspections that take place from the health department. There's a reason that these businesses that are at street fairs, farmers markets, they go through this permitting process to make sure it's healthy for everyone that attend. Now, when we see someone that just sets up on the side of the street, on the end of a corner, a vacant lot, there are concerns that automatically kind of red flag for me. Can you touch on that a little bit about the reasons why people should, before they just stop off on a dirt lot and purchase things from a roadside vendor that's not permitted, the health concerns?
Yeah, absolutely. From a public health standpoint, from our infectious disease standpoint, we worry about things like foodborne illness. And so one thing I always tell people is, when you see a stand by the side of the road, and think about, where does that person wash their hands? If they are there from 8 a.m. to 5 p.m., where do they use the restroom? When we think about something like a food truck, there is potable water where they do wash their hands. Food trucks have specific locations because they have to get agreements with somewhere nearby that says they can use the restroom if they need to. And those are things that we want people to consider. Where do they wash their hands? How often do they wash their hands? If it's something like, for example, cut up fruit, they are touching the food you're going to consume, and you don't, there's no evidence that they've been able to, properly store it or, keep the utensils that they're using safe and clean, that they have protected against cross-contamination. When we're out in the elements, there's things like vermin, flies, if there are rodents running around, that, a sort of roadside, cart may not be able to protect against. And so those are kind of things we want people to consider, of both sort of, we call it the ick factor as well as the sick factor of, and, for something like food, it may not be immediately that you get sick. Something like salmonella can take several days. And so sometimes we don't even associate it with something that we had, a few days ago, but we just ask people to really consider, if they don't have a permit, then we have no way of assuring they've gone through proper training, that they have taken care of the food or the materials that they're using in an appropriate manner to minimize your risk. And so, we always want people to make those educated decisions, but really be thoughtful about that, because if you consider, if I'm on the side of a road at an intersection of two highways, how far is it to the nearest restroom? Where do you think that person relieves themselves if they need to?
Right.
There's a whole other component that we're not involved with as much in public health, but, you might have been in law enforcement about, human trafficking and labor trafficking,
right.
Where who chooses in the heat of summer, it's 115 degrees outside, to sit outside, and in the heat, selling. And so, we know there's a human aspect to this, and we try to be respectful and understanding that there's, this is a human being and there is a need, they are trying to make money. But we worry as for our community of the safety and the health of our community. And there's also just this thought of, how is this person here? Are there other ways and other mechanisms of things they need help in? Because it's not always just this enforcement. You should never do this. But a lot of people are in situations where they do need support in other ways. And if we can navigate them to other resources, then they might not be in a situation, that puts them in that environment.
Yeah. It's amazing. When you see some of these foods that are being prepped and the thought of the cross-contamination, I think back, if I'm in my kitchen and I'm getting ready to prep something, I'm washing my hands, it seems like, after every time I touch something. And when they're out, at this vacant lot, they don't have access to do that. And I don't want to see them dip their hands into a bucket and then dry them up, because that's not taken care of. You're still going to cross-contaminate.
Right.
So I really try to think, I've had the conversation with my wife. It's like, no, we're not stopping there, and the reason is it's about the health, it's about the safety, and even the human trafficking, and that's a whole nother conversation and podcast that we could get down into. But just on the health side, I think that's, and I don't want to dissuade the entrepreneur, but there's a correct way to do it. And the health department will license and permit certain food vendors. You have to meet the standard. Maybe it's with the food truck, and they go through a process, and you vet their education. You make sure that they have the capability of heating things at the proper temperature. They have the ability to clean. Those are all some of the aspects that go into what you do.
Yes, absolutely.
So, well, thank you for that. I appreciate that because it has been an issue and some people don't understand, but I think they think about, hey, this guy's just trying to make $1. I get it.
Yep.
But there's the health aspect that's in for us in government. Public safety is our number one goal.
Yes.
So that's the thing that we kind of work together as neighboring sister agencies to make sure that we're all on the same page of working together with a common goal of the public safety.
Right.
So we've talked about a lot of different things, and I appreciate your time. Is there anything that we haven't talked about you think that might be of interest or concern?
Something we haven't really hit on today is chronic disease, which is something,
Okay.
we have lots of concerns of, in public health, right? Chronic disease is something where, unfortunately, it's going to take us 5-10 years to see if we've really made an impact on it. But we know in our community, for example, Kern County has the highest mortality rate due to diabetes in the state. And so this is something that's really important of, why are people, we don't have the highest rate of diabetes of people having diabetes, but, our population in our community, people with diabetes are more likely to die in Kern County than other places in California. And so a lot of things we're looking at are, why is that? What do we do about that? For one, it's a lot of undiagnosed diabetes. People may not know that they have it. And so, it's going untreated. Chronic disease is something a lot of us, may know about and think about, but may not always take every action that we could. A lot of chronic disease requires a lot of sort of long-term management with healthcare and being able to go to those routine visits and have your doctor check on you and decide whether or not you need medication, if there's a lifestyle change or an environment change that would benefit you. And so we're always looking at other ways to allow people to sort of know where they are. One of our newer programs, I don't know if you've heard about, it's called Know Your Numbers. We're out in the community and we are doing sort of these health screenings of checking your blood pressure, your cholesterol, your blood sugar, and to say, are you at risk? Do you have an elevated number where you might want to go talk to your doctor about it? And part of that program also, in addition to doing those health screenings, is offering nutrition education, physical fitness, activities of really trying to help us as a community develop healthier habits around, so to hopefully reduce our rates of chronic disease. Because we know something like high blood pressure is affected by your diet as well as, your physical activity. And for many of us, we could all, do a little better. We've been talking a lot this year about, a healthier Kern County and taking those tiny steps to be just a little bit healthier. If it's take the stairs today instead of the elevator, if it is, let me say, no to that piece of candy that I really want, but today I'm just going to be like, no, I don't really need it. Of, a piece at a time, making healthier choices so we can have a healthier community. Because we know chronic disease, for one, is expensive, and that, if we can prevent it, that we could all be healthier. For a lot of us, it's about demonstrating those healthy habits, to our children or our grandchildren, and saying, this is a fun way to be healthy, and encouraging, let's eat healthy foods, from our farmers market. Let's have some physical activity as part of our lives, not exercise and having to work out, but the things we do already that we can increase our heart rate, spend time with our families, and really encouraging that environment that is a healthier Kern County. We know it's hard sometimes as we have, super cold winters and we have super hot summers, that being outdoors and getting physical activity in can sometimes be challenging. And what are the alternatives to saying, I'm going to move more today? I'm going to, make smart decisions about what I eat and drink today. And so I think that's something we always encourage people to do. It's hard because the benefit is not immediate, right? Even if someone, who is trying to lose weight, it's not, you may have restricted your diet and increased your physical activity, but you don't see it tomorrow that you've lost 10 pounds, right? It's a long-term ongoing thing, and it's sometimes hard to upkeep and to change those habits. And we just want to really encourage our community to find ways, hopefully with each other, of spending time, physical proximity. I know over the last couple of years, we really learned the value of being physically with one another and spending time to, yes, we can go out to eat, but we can make healthier decisions when we go out to eat. Yes, we can exercise and we can find, we can make time in our lives. We all feel so busy, but, it can just be 5 minutes of saying, I'm going to do a little bit more and then have a healthier lifestyle. And that hopefully, reverse some of those effects we might have if we have high blood pressure, high cholesterol, diabetes, help manage those things so that we can have long, healthy, productive lives.
Wow. It's something that we just started that, and it's really kind of based on the things you're talking about, little things that we can do. And we thought here at the city, we've had success with Coffee with the Mayor. We invite the community to come talk to us. Coffee with a Cop, some other programs like that. We thought, why don't we create a walking group?
Yes.
So we have a walking group where every Thursday morning at 11, we invite the community to come and join us. And we have a 2 to 3 mile loop that we walk through downtown. And we invite the community to come out, talk to us, have a conversation, but just talk about, getting a little bit healthy and having, and getting to enjoy the beautiful Tehachapi scenery. Well, that sparked our Parks and Rec district to have a fitness challenge, a quarterly fitness challenge. You could put teams together. So we put a team together that's now in this. So we're all walking. There's 20 members from the city and over 40 teams in our community that are part of this Spring into Action fitness challenge. And I've noticed that the individuals that are on our team are all kind of getting that little, they did it the first week. And then the second week's I walked a total of 8 miles last week. I'm going to do 10. And it's that we kind of inspire each other, or the competitive nature that's in us. And all of a sudden, before we know it, we're all tracking each other's miles in this inner competition. And it's healthy, it's fun, and it's added to the kind of the social aspect of us all interacting. There's a lot of benefits to something as simple as just walking.
Yeah, absolutely. I love to hear about that. That's so exciting and so much fun, because it's a little thing and it's a few minutes out of the day, but it can create such an amazing environment because, we have worksite wellness at Public Health as well. And what I love about it is you get to interact with people you may not normally,
Right.
for you bringing the community in, it says, I'm a person. We're just normal
Right.
people, and we're just going to have a conversation while we're hanging out and talking, but so much can get done. You get to meet people and understand people and find needs and problem solve in sort of that new environment, and of course we know that exercise and movement is really good for your brain. And so sometimes you have those aha moments
Right.
and something we're just walking around and what a wonderful way to enjoy your community. And so I love that concept. And, it's like everything else. Once you get that ball rolling, it keeps going, and then it speeds up and you have more competition, and, you realize, it might have taken you half an hour to walk those 2 miles before, and now you're getting your 2 miles in 15 minutes, and all of a sudden you're doing 4 miles in the same amount of time. And that energy can build on itself. So
Yeah.
It's an amazing thing. I'm so excited to hear you guys have started that and how well it's going.
And staff, people will walk by my office because I'm the team captain for our team. He goes, I'm walking to lunch today.
Oh.
Or I'm walking to our next campus, which is just a short distance away, but they're walking instead of jumping in the car to go over to the police station or something. Just little things like that. But they're letting me know I'm getting my steps in. All right, I'm getting my steps in. And it's been really good. And talking with our city manager, he's had some great conversations, very constructive, that people have come out to ask about things. And these are people that we don't see come to Coffee with the Mayor and the other events, because for them, it's a motivator too. They're like, okay, I need to get out and walk. Okay, and they ask about their city government, and we're there to answer those questions. So it really has been connecting us with the community. And then we're personally, selfishly getting a little bit of a benefit too.
Absolutely. That never hurts. But
Yeah.
what an opportunity, especially, not everybody, some people can be kind of intimidated by that sort of
Right.
formal. I need to make an appointment and sit down at a desk and, be dressed nice and things like that. And, this informal ability that says, just come talk to us. We're going
Right.
to hang out, and it doesn't have to be anything you need. I mean, we could just, talk about, the sporting events that happened over the
Right.
weekend, and that opens up the conversation to
Yes.
when they need something,
Yes.
they know who you are, and they know that they can ask you and that you're willing to listen. I
Exactly.
think that, puts us out in the community as people and part of the community. We're not
Yeah.
behind that locked door.
Yeah.
So that's wonderful. And I'm just so excited, for the whole community of Tehachapi to be able to access government in that way, but to really just be involved and to be inspired and really, enjoy this beautiful community here.
Yeah, it is. This is a very special place in Kern County. And, just before COVID had hit, I know the public health department had come up. You guys were getting ready to launch some health programs in the community. COVID hit, shut it all down. So when you guys are ready to re-kick those off, tell Michelle
I will tell her.
to let me know we're on board, because we were going to be on board when they were ready to launch. So City of Tehachapi is a go.
Awesome.
So anything, Kim, that we haven't talked about that you want to get out? I know I've hit you that with that a couple times, and you've had a couple more, but.
No, we just, we always want to encourage our community to make those healthy choices, and we welcome questions, we welcome comments, because we're always looking to partner with our community, right? In government, we can lead and we can support, but we really need the community to come around and say, here's what we need, here's how we can do it, because we're here to be part of it, not to tell people what to do or tell them how it should be done, but, what's the need, and figure out how we can support that. And, some of our most successful work is really community driven, that either the ask came from the community or the first steps came from the community, and then we were able to help partner or to build bridges so that these things can flourish, because I think all of us in our community want to be healthier. We want a healthier environment for ourselves, for our families, for our loved ones, and that we all want to be able to contribute to that. So we welcome that at Public Health. We're excited to be able to be back out in the community again. We've been able to sort of bring back all of the old services, because like you mentioned, during COVID, a lot of things were very focused, a lot of things shut down, and we're seeing, in this year especially, just stuff coming to that new normal of being together, right, and opening up and being in person, and new ideas coming out of what was and what can be. And so we're really excited in this period with the health of our community, that we have a positive, hopeful outlook for all of Kern County, that we can all make healthier choices as an individual person. We as a community can come together to foster healthier policies, and support healthier environments, and that when we look back, we will say, this was, we all love living and working in Kern County. This is a wonderful place, right, to be, and that we can leave a brighter spot, when we look back on it in 10 or 20 years.
Yeah. Now, if people want to reach out or have a question, website, Facebook, social medias?
Yeah, we have social media. We have our website at kernpublichealth.com. They can always call us at 661-321-3000. Like I said, we can't solve every problem, but we do really often have the ability to help connect people to where they're trying to get. If they're not sure who to talk to, we will always do our best to kind of find that right resource, that right agency for you to talk to, depending on what you need.
Well, you guys have always been receptive to us when we call, so please tell Bryn thank you. I know that Greg would want me to say that, because Bryn has been a great partner since she has taken over, and it's just been a good working relationship that we have. So please tell her thank you, and I appreciate your time coming up from Bakersfield to make the trip up here to share what you have today.
We are happy to do it. We are grateful for you as a mechanism of communication, of getting good information out to people so they can make those healthier choices, and as a place to start asking those questions so that you can be that voice for them. So we appreciate all the work that you're doing and communicating with the community.
Well, thank you very much. It's Kim Hernandez, lead epidemiologist for the County of Kern's Public Health Department. Thank you very much.
You're very welcome.
All right, folks, if you've got a thought or question based on today's conversation, send it to us at media@TehachapiCityHall.com. I'll get it to Kim, or we'll get the answer for you and send it right back. We appreciate the time you spend with us, and we'll catch you again soon right here on Tehachapod.
Tehachapod is a conversation about Tehachapi, featuring the community members who make this such a special place to call home. If you have a question or a thought you'd like to share, email media@TehachapiCityHall.com. Thank you to Gary Mazzola for sharing his song, This is Tehachapi.